Well, how does excessive estrogen then cause this hormone imbalance?
When the body is exposed to or consumes more estrogen than the amount of progesterone it has, it causes a hormone imbalance that gets more severe with each passing year. The medical answer to female hormone imbalance, as when diagnosed with PMS, is birth control pills. However, birth control pills suppress the production of progesterone, which results in estrogen dominance.
So what is estrogen dominance?
Estrogen dominance means that the body has too much estrogen in ratio to progesterone, testosterone, or other hormones. So when a young woman starts birth control pills for any reason, she has started on a journey towards estrogen dominance.
Well, then estrogen dominance is definitely a serious situation.
Yes, it is, Jordis. When the ratio between estrogen, specifically estradiol, is out of balance with progesterone, with this excessive amount of estrogen and low amounts of progesterone, this progesterone dominant state can lead to longer and longer menstrual cycles. In other words, instead of menstruating for 4 to 7 days as is normal, menstruating may last for weeks, even months and months without stopping. This hormone imbalance can also progress to other severe symptoms like pain, endometriosis, or precancerous tissue. It is at the root cause of breast and uterine and prostate cancer. Women in perimenopause and in menopause often experience symptoms of hot flashes, hot sweats, mood swings, irritability, headaches, and other symptoms similar to premenstrual syndrome. And they may think that a hysterectomy is their only option for relief.
Well, a hysterectomy, which is a surgical removal of the uterus and or ovaries, then is a primary medical solution.
That's right. However, Dr. Janet Lang states that over 90% of hysterectomies are elective. I've often thought that to choose a hysterectomy, as in a case of a woman who's menstruating for weeks and weeks, is much like removing the engine of a car because of an oil leak.
So what does this word elective mean then?
Elective means that there's no life-threatening reason for the hysterectomy. The woman has elected or chosen to have it done.
So why would a woman elect or choose to have a hysterectomy?
Choosing a hysterectomy simply means that neither the woman nor their doctor was aware at the time of other less radical options, like clinical nutrition therapy, that can help restore hormone balance.
So clinical nutrition therapy could supply the nutrition and the nutrients and the support the body needs to balance and restore the proper function of the hormones safely, and by doing these, will the symptoms leave?
Yes, they do. Clinical nutrition therapy can also help the body repair damaged cells and grow new healthy tissue, which is so important in the case of endometriosis or precancerous tissue.
Well, how does a woman know if she's becoming estrogen dominant?
The best preventative measure is to contact our office for a female or male saliva hormone test. Saliva testing is becoming more popular because it's testing hormones at a cellular level, which blood hormone testing does not do. Also, it may be years, even decades, before the blood shows this imbalance. So a saliva hormone test is truly early detection for hormone imbalance. Ideally, you want to have an initial saliva test to identify your current hormone levels, whether you are an adolescent or an adult. Then begin a clinical nutrition therapeutic supplement program to provide the nutrients the body requires to correct the hormones that are identified as being imbalanced in this saliva test. Once corrected, an annual saliva test can monitor your exposures to outside sources of hormones in your environment, as through plastics, personal care products, foods, and that way you are able to correct these imbalances before they become symptomatic.
Well, and if our viewers already have symptoms of premenstrual syndrome or PMS or pre-android pause or PAS or other hormone imbalances, will having a saliva test tell them how to correct it?
Yes, if your saliva test indicates that you have too much estrogen or too little progesterone or too much testosterone, I can provide a therapeutic supplement program and dietary plan to raise the levels that are deficient and decrease the levels that are excessive.
Well, Dr. Smith, we're going to be taking a short break right now, and when we get back, then we're going to be coming back to our viewer questions.
Great.
Perfect. Welcome back to Dr. Smith's Secrets to Healing, which airs every Tuesday evening from 9:30 p.m. to 10. And I'm Jordan Bradley, a licensed massage therapist, here with Dr. Smith, who holds a PhD in clinical nutrition and is a naturopathic doctor. Dr. Smith owns Advanced Clinical Nutrition right here in Wichita Falls. And today we are talking about balancing female and male hormones using clinical nutrition. And I'm very excited about this. Right now it's time to do one of our viewer questions, and this is from Karen of Wichita Falls. She writes, Dr. Smith, a few years ago, progesterone creams came on the market. Even more recently, bioidentical hormones. Do you recommend them?
Karen, that is an excellent question, and thank you for asking it. However, Karen, I do not recommend using hormone creams for 2 reasons. Before I explain why, let me clarify for our viewers that while progesterone creams contain only progesterone, bioidentical creams may contain both estrogen and progesterone, depending upon the formula compounded for you by the pharmacist. Hormone saliva testing identifies which hormones are needed. The reason I do not recommend creams is because the dosage cannot be measured or monitored accurately. A woman may use a teaspoon of cream one day and a tad more or less the next. And is the amount on the fingers, when the fingers are used to apply the cream, considered in the dosage? The amount on the fingers is also absorbed into the skin. So women using creams often get more than they need. After about 8 months of using creams, for example, they can have the same symptoms of depression, irritability, excess bleeding, hot flashes, sweats, and so on that they previously had. The important key is hormone balance. Being progesterone dominant can cause the same symptoms as being estrogen dominant. Because women using progesterone or bioidentical hormone creams originally received some relief when they first started using them, they often do not associate the return of their symptoms 8 months later with the use of these hormone creams.
Wow, that's interesting news. What's the second reason you don't recommend these hormone creams?
Chemical preservatives and binders are often used to hold the hormones together in a cream form. Chemicals such as PEG-8 stearate, propylene glycol, or methylparaben. Over time, these can cause toxic chemical buildup in the sites where the creams are applied. For example, a local physician referred a patient to me who had been suffering with 30 to 40 bouts of diarrhea every day for over 10 years. Within a few weeks on her therapeutic clinical nutrition whole food supplement program, she was no longer suffering with these bouts of diarrhea, and at one of her follow-up appointments, she announced that her physician had put her on a bioidentical hormone cream. When I asked her if she was experiencing any new symptoms, she said that she was having pain in her wrists. I asked her where she was applying the hormone creams, and she said, my wrists.
Wow. I'd like to summarize for our viewers what we've been talking about here, Dr. Smith.
Okay.
So hormone creams cannot be accurately measured and may have chemical preservatives and binders in them which have toxic side effects. So then would it be better to take hormones orally?
Yes, Jordis, when taking hormonal herbs, taking them orally is better. It is always important to be tested first. Then with the saliva testing, with a saliva test, you know exactly which hormones are deficient and which are excessive. To help the body balance hormones, I recommend herbs first because they are whole plants. The body can safely and totally use the hormonal herbs as estrogen or progesterone, depending upon the herb used. Some herbs would be recommended if a person was estrogen dominant, and other herbs would be recommended if they're progesterone dominant.